people who are living with a terribly high rate of tuberculosis. In fact, an Inuit person today is 300 times more likely to be affected by tuberculosis than any other non-Indigenous Canadian-born person. So the SeeChange initiative really began with that, with how can we do something to change the reality of Inuit people? Why is it that today in a country as rich as Canada, with such an incredible health care system that's supposed to be accessible and available to all, why is it not working in Nunavut? And what could we do? What kind of approach could we bring that could change that around? So after we went there as a result of Stephen Lewis, who some of you may be aware of, he's a pretty famous Canadian in the global health field. He went on a visit and in the end of 2017 and talked about that there was really this kind of cultural genocide going on amongst the Inuit, and it was actually a sort of a strategy that had lasted from the colonial history of our Canadian Arctic, and that this was resulting in these needless deaths in the north. So I went up there and started working with an Indigenous organization based in Clyde River, which is out on the far east on Baffin Island, one of the communities actually nearest to Greenland. And we started working with a community organization there to look at different approaches. And we started really with this community-based approach to tuberculosis, which really recognized the colonial history and the trauma of TB and the history, but also then help to give community members information about tuberculosis and how they could take their own health into their own hands and become able to prevent and to do early diagnosis of tuberculosis in their communities. It was extremely successful in the terms that there are lots of community members attended and now have become their own ambassadors in their community for this. So this really is the concept of community first. How do communities take their own responsibility for their own health and be able to meet the health authorities in a place where they say, this is what we can do, these are our assets, but we need this, this, and this in order to complete the picture. Mm. When COVID struck, we completely pivoted our program to that. And the community came to this and said, we don't know how to prepare ourselves. We don't want this to come into our community. We know what happens when infectious diseases arrive. It tends to spread like wildfire. We remember the influenza of 1918 when so many of our family members died. And now here we are with tuberculosis. So we understand this kind of disease that spreads by droplets. We've already been working on that. So we set up an emergency preparedness plan for them, which we called the CommunityFirst roadmap. And they set up a whole plan for their community, what they needed to do, how to do social distancing, how to wear masks, what to do in their store, what to do in their homes, because Inuit live in very, very crowded, poor housing. So actually social distancing and living apart from each other is very difficult. So we put in systems for that. And then we took that roadmap and said, you know, there must be other vulnerable and isolated communities who could also do with something like this. And in fact, that was the case. And today we have 12 countries, 12 communities in 12 different countries using this kind of emergency preparedness for COVID-19. And most recently, because of the terrible floods that are happening in Honduras and Guatemala, we're now converting that roadmap as a response to the flooding so that people can protect themselves in their communities, because the help is not coming from the central authorities.
It's brilliant, you know, the idea of empowering communities to look after themselves and teach them what they need to know to look after themselves. And it came along at this very important time as COVID was hitting so hard all around the world. I want to let people know your background, because I'm sure some people watching are going, I don't understand. How do you go from, you know, a woman living in Montreal West and now you're up in Baffin Island and so really, you were a lawyer, and then in 1989, you made a decision that seems to me to be life-changing. Tell me about what you decided to do in 1989 and why you made that decision.
I was a young lawyer working in London. I had spent 1 year after university and before starting my law articles, I'd gone traveling for a year, you know, the backpacking dream. And I'd ended up on a small island off Sumatra in Indonesia. And I'd been to visit, and the tour was advertised as visit some of the last primitive people in Indonesia. And you know, as a 21-year-old, I was fascinated by this. I was like, okay, I'll go. And it was changed my life, because I realized I'd been there as a tourist to see, but these were not, I was not going to a zoo to see animals. These were human beings with a life, and they were being absolutely overrun by logging companies who were planting palm oil plantations. And the government of Indonesia was trying to assimilate these indigenous peoples into the mainstream Indonesian culture. So take away their language, take away their homes, put the children into the general public schools. And just as I was leaving that week, the whole week I was there, I felt more and more horrified by what I was seeing, and also the levels of illness in the community. And as I left, one of the people there turned around to me and said, you know, please, can you help us? So when I went back to my law career, this played around in my mind. And at some point, someone arrived from Indonesia in London and looked me up, because I'd started a small NGO in London to try to do something about what was happening to this island. And she said, would you come back to Indonesia and work with us and work with the community? And 6 months later, I was on a plane to Indonesia. And that was the beginning of the rest.
It's incredible. I don't know how many of us would have had that instinct to do this. Oh, I was 21, I went back and I came back and I started a little NGO. You know, it's really, it's very, very impressive at such a young age for you to have had that instinct to help those people. And going there connected you with Médecins Sans Frontières, which was a huge part of your career. Tell us about that part.
So I left Indonesia in the early 90s, and I was meeting with a friend in a pub in the south of England. And I told him what I'd been doing. He said, you should join MSF, Médecins Sans Frontières. And I'd never even heard of them. I mean, this was when MSF was still a very small organization. No one knew about them much. And everyone thought they were sort of this bunch of cowboys who went and did these strange things overseas. And I said, well, first of all, I'm not a doctor. So what would I have to do in MSF? I'm just a lawyer. And he said, well, I'm a lawyer too, and I'm running a department. And I was like, okay, fine. So he asked me to help set up MSF in the UK. And then I became more and more involved and left on my first assignment with MSF in 92, when I went to the Horn of Africa. And then I spent many years working in Africa with them, sort of most notably probably where I was in Rwanda before, during and after the Rwandan genocide against the Tutsis in 1994. And then I spent many years in the Democratic Republic of Congo afterwards, dealing with the refugee crises that ensued after the Rwandan genocide.
And you ultimately, in your career, you were at the head of MSF International before you left them, right?
That's right. So I went from field to being very close to people and sort of gradually moving around. And I ended up on the International Board of Directors of Médecins Sans Frontières. So I did that for 6 years, which was an incredible position to be in terms of being able to guide what was now an enormous, $2 billion organization working in 70 countries with over 36,000 staff. To be able to be at that kind of position to help guide the organization in its direction in a time when humanitarianism is very much under fire, literally in terms of our hospitals being bombed in places like northeast Afghanistan, all the way through to many of the populations that we're working with being criminalized, such as the migrants who are trying to, and the refugees who are crossing the Mediterranean Sea, or even in our own back garden here, from trying to come up from Central America to flee the terrible violence in those countries. So to be part of the organization at such a time of turmoil and to try to find our path through was a really great privilege.
So how did you find your path from there to Montreal West and raising your family in this small community in the West End of Montreal? What drew you there, and why? Why did you choose this place?
It's only one word, it's love.
Oh, okay, we could have guessed.
For any non-Canadian who comes to live in a country that has such cold winters, which are really, really hard unless you've grown up in it and you've grown up on skis or ice skates or something like that. To move here is quite something. And Montreal has got a long winter. So it was love. I fell in love with my husband on a mission in Rwanda. And after we got married, we decided where to settle, and it was we started in Ottawa, and we eventually came to Montreal. And we were living when we first, because we'd been in Costa Rica for 5 years. And then when we first came back, we were living in Côte des Neiges in a small second floor apartment with 2 little boys running around. And it was like, I was like, okay, I can't. And it was the winter time, and I was like, okay, it's done. So I started to drive around and look. And actually, it was before the winter started, it was October. And I came to Montreal West by car, and I was drawn by all the pumpkins. It was time of Halloween. And around all the houses, all the pumpkins were out in front of all the houses. And I said, this is where I want to raise my children. And so we were lucky enough to find a house, because at the time they were already hard to come by. But I live here now, and it's amazing community. I love it. It won't
Montreal West, yeah, they do put on a show at Halloween, don't they? That was the perfect time. So how long have you been living back in Montreal West now?
16 years now.
Wow.
It's incredible to think. Yeah.
It goes fast, doesn't it?
Mm-hmm.
So I want to get back to the SeeChange initiative. And you said something when we were communicating by email about how COVID has been such a challenge, but is also such an amazing opportunity to make systemic change. So, I mean, I'm sure that there's a lot of scrambling working in all of those countries to just try to control the pandemic now. But what do you see as some of the opportunities of this pandemic to make some systemic change?
Yeah, I call COVID-19 the ultimate disruptor, because it's really disrupted everything. I think that we all knew that there was a lot of poverty in the world, that there was a lot of issues of racism, that there was, there's something wrong with our capitalist system, where the rich seem to get richer and richer and the poor seem to get poorer and poorer. There's this sort of divide. There's people that we live in our kind of media bubbles or in our social bubbles, and we don't even see the other side anymore. We don't, there's so much polemic going on. Yeah. And I think COVID has exploded that. It's exploded the fact that, it's not about north, south, developed and developing countries anymore. We're all humans. This is about humanity. We're all in this together. We're all trying to cope with the same disease. It doesn't affect the rich more or less than the poor. And we've seen, in fact, how COVID has highlighted a lot of the social dysfunction that we have, the fact that racism is still very existent in our society. The whole Black Lives Movement has been really propelled by this crisis. People in communities have seen that their national health system or public health system or emergency response has failed them over and over again. We saw it in our own city of Montreal, where our elder care is, being exposed for what it is. And even now in this second wave, we're seeing our elder population suffering yet again in those homes, when we should have sorted it out by now. There's just something wrong with the way that we're living, with the way that we treat our environment. The fact that our environment, I'm sitting here today on November the whatever it is,
10th,
the 10th, and it's 23 degrees centigrade outside. I had my door open all morning. I'm back in my summer clothes. I mean, there is something going wrong. So COVID has exposed all of those things, and it's given us this opportunity to re-look. It's taken us down, as we would say in French, à plat. We've had to stop working. We've had to stop going to the office. We've had to stop traveling. We've had to stop doing so many things. And I think that gives us an opportunity to reevaluate today where we are on an individual level, on a community level, and also on a national political level. I think it's the moment to bring in policies around the environment that are strong and meaningful. And thank goodness for the election in the south of the border, that we actually have some hope now with the new Biden-Harris administration, that we're going to really do something concrete in North America to do around the environment, and to go back into the Paris agreements. But then the other side, going back to more where I'm focusing on this community first, I think it's really showed the power of the community. If we look at our own community here in Montreal West, we had to take steps as a community to protect ourselves and our different and more vulnerable parts of our population. We all suddenly were going out, delivering baskets, going shopping for people, setting up groups that people could communicate, seeing how to keep that social fabric alive. This is a repeat story of what's happening in communities, millions of communities all over the world. And these communities really have been the ones who prevented and worked the hardest to prevent the spread of COVID-19. We're lucky in Canada, we have, you know, in our part of Canada at least, that we have a strong health system and good hospitals. But I work with a community in Honduras, who I was speaking to yesterday. They don't have any support from their government or from their public health environment. So it's up to the community to make that response. And the COVID-19 has shown them once and for all that it's really about how they act together in solidarity with each other and accompany each other through this crisis.
And that's where your Community First initiative comes in. And you do have a fundraiser going on for that. So while we have all of these people on the line, let's take a moment to promote that before we open it to questions.
Yeah, we do have a community fundraiser. What we're doing is we're raising funds, small funds for communities who need to get masks and soap and disinfectant. Because we have to remember some of the communities don't, you know, it's fine for us to say, wear a mask, wash your hands, but they don't even have the basic materials to doing that. So far with the fundraiser, we've provided disinfectants and cloth masks and soaps to communities in Kenya and in Honduras. And we're carrying on with that work now. And you can find it on all our social media platforms. So it's at SeeChange.
At SeeChange. Rachel, thank you so much for your time on this. We want to allow people to ask questions and give them time to do that. So I'm going to send things back to Deborah so she can open people's microphones and let them ask their questions. Deborah, are you there?
Yes, I am. I'm just going to ask people if, well, I actually have a question for Rachel. So I'm going to start the questions if I can. Rachel, how do you keep your optimism? Because you sound extremely optimistic and you're working so hard. And I'm just wondering, on a personal note, how do you keep that optimism alive? Because it's so hard in 2020 to be optimistic. It was so hard in 2016 when Trump got elected as a woman to be optimistic. You know, I have a young, not so young anymore, but I have a daughter, and it wasn't supposed to be like this. We were supposed to be past so much. And it seems that we've heard it. So I want to know, because you're in it every day, how do you keep your optimism alive?
I don't know any other way to live, is the short answer. Because if I don't feel optimistic and believe that things can change and that as human beings we can do better and we can advance and move forward, I think my life would be a very sad one. And I sort of have this one opportunity, to be on this planet, and I want to do the best that I can and live the most joyful life that I can. I feel very fortunate that the work that I do always gives me the opportunity to help in the most difficult circumstances. So when COVID-19 began, mine was like, oh my goodness, I was lucky because I could say, oh, I'm going to change the work that I'm doing so that I can do something around COVID-19. In our community, I set up an Ask and Give for COVID-19 Facebook. That was my first instinct in our community to do, so that people would have a forum and a place to talk. But then also at the same time, I was pivoting our work on tuberculosis towards COVID-19. So I think always feeling involved and being able to be part of a response is for me really helpful. But the other, probably the more fundamental thing is that human connection. I get so much joy working with people, whether I'm working with the Inuit in the Arctic, whether I'm speaking with women in Honduras or Guatemala or a community organization based in Kenya. They give me so much joy and inspiration because they're working so hard for their own communities, and they have so much joy and excitement and pleasure in what they're doing. And we share the ups and we share the downs. And I think that human connection for me really keeps me going.
On another note, just curious, how many languages do you speak?
I speak 3. I kind of learning a 4th, and I have a 5th in my back pocket. But 3 I speak well.
Thank you.
I see there's a question in the chat, Deb, from Mary. Are you involved in local projects? She's asking. Adore the global initiative, but ESP, especially given the US election and the importance of grassroots, what can we do here, right here?
Well, I think that we can we can do work to support the most vulnerable communities. So I think here in Montreal, there are some really very important initiatives going on with populations of new arrivals in Montreal. people who've been fleeing violence. There's work being done with like Médecins du Monde, who's doing free clinics and making sure there's access to healthcare for undocumented migrants in Montreal. I think we have a lot of, I know that we have a lot of Inuit populations based here in Montreal who are going through an extremely hard time when some of the shelters were shut down. Thankfully, they reopened one of them now, but there's always need for support there. And then I think support just in our own communities. I know at the beginning of the first wave, I was involved in helping to do shopping for people, for my neighbors who needed help to go and get food, who didn't, my more elderly, more senior members around me who didn't feel comfortable to go to supermarkets and to go out. And that's something that we keep doing and keeping the connection. But I think there are a lot of projects here. Why did I end up working in Nunavut? Was because I felt that it was so extreme what's happening with the Inuit people, and the experience that I brought. I've worked a lot in tuberculosis projects. I've worked a lot with those kind of extremely vulnerable and isolated communities that felt like the best place that I could contribute. But I also have contributed a lot to the migrant situation here in Montreal, because that's something that I feel really, really strongly about. That if people come to our land, this country of immigrants, I'm an immigrant, we should welcome them in the way that they deserve and make sure they can arrive here with dignity and humanity and have the basic things they need for their families to find a new life.
Any other questions from people? Deb is standing by to unmute your mics if you want to ask them live, or feel free to send them to us in the chats. Oh, Carolyn has her hand up. Deb, can you unmute Carolyn?
Hello.
Hi.
Hi, I'm just curious. You mentioned Honduras and you mentioned Guatemala. I guess I'm just curious about the COVID situation in Belize. I've visited there several times, and I know people there, and the country's so reliant on tourism for its economy. I was just wondering if you knew anything about what's going on in Belize.
I don't know specifically about Belize, but in terms of the general situation in Central America, I think you hit on something really important. Is some of those countries are extremely dependent on tourism, and they get a vast amount of their income from that, and their work is based on that. And I think that's going to, the economic hit that those countries are going to take and communities are going to take because of the lack of tourism is really significant. In terms of the actual presence of the disease, I think it's much more present than we know. What I'm hearing from communities is that there is no testing, that there is very little understanding of the numbers. People don't really take it, some people don't really take it that seriously, think it's just another way for the government to try to control them, and others are very, very frightened and worried about it. And so it's not at all a universal response in Central America. And I think each country is going through its own things. There hasn't been reports of really big outbreaks, except in Mexico, where the rates have been seen to be extremely high. And there's a lot of concern in the communities where we're working there. And people are much more, being much more serious. But unfortunately, COVID in many countries has become a political issue. We saw it in the US. And it's the same story in Honduras, in Guatemala, in Mexico. It's being used as a political tool. From both sides of, or all different sides of the political spectrum, which leaves communities in an extremely vulnerable and difficult situation because they don't know what's true and they don't know what's false. And so one of the things we've tried to do with our Community First roadmap is to make sure people have the real information and they can access what's true. We use information that comes from the World Health Organization or from the Pan American Health Organization, or from Médecins Sans Frontières, Doctors Without Borders, or the Red Cross. So it's all extremely carefully curated material so that when people have it, they know that this is the true information. But it's extraordinary for me to hear what kind of information and the kind of rumors that are going around, and how people say that you get it, they're making parallels with HIV/AIDS, and then you get the situation where you have as always, the women and the children become extremely vulnerable. So I was talking to someone this morning, Cecilia from Honduras, and she was saying already as a result of the passage of the hurricane and people losing their homes, already they've heard cases of women being abused and violated, of children having lost their parents or being lost from their parents and being orphaned. And there's really very little response. So we're trying to help them now to get organized. They have an amazing group called the Organized Women of Retoka. That's the community we're working in. And this is their official title. They're just fabulous, bunch of women, 15 of them. And they go, and their community is about 11,000 people. So it's no small feat. But they're going around and they're setting up what they call albergues, so little refuge houses that families can go to, trying to find mattresses and milk for the babies, and sending me pictures all day of, you know, things that they've managed to do. And so we're just trying to help them to organize the response. And then, you know, the fundraising we do is for punctual assistance, mainly around the COVID. So to give them some money, to get them materials so they can make their own masks, or to buy a sewing machine so that they can start their own sewing group to do that. That's actually what we're doing now in Kenya. Sorry, Carolyn, I'm going a bit off your question, but I'm using it as an excuse to talk about other things. But, you know, I think there's a great potential for communities to be able to do a bit of social entrepreneurship. So in Tana River in Kenya, they asked us if we could provide them with a couple of sewing machines so that they could start making their own masks. And they have someone in their community who makes soap, an ecological soap, friendly soap without any of all the detergents. And so they needed some of the basic materials to make soap. So we've just sent one of our activators who's based in Kenya has now gone down. And it's wonderful because you find around these big issues, so many people volunteering. So I have a friend of mine in Kenya from MSF, and now he's volunteering with SeeChange to try to get in contact with more communities down there. All the people we work with in Mexico and Central America are all volunteers and friends of mine from my, you know, decades of traveling all over the world who sort of helped. But unfortunately, I don't have anyone that I know in Belize, and I've never been to Belize. I've heard it's beautiful, but I imagine that they are suffering because of the lack of tourism, or they will this winter. And I don't see why their situation should be much different from Honduras or Guatemala, quite honestly.
I will inform myself. Thank you.
Pleasure.
Thanks, Carolyn, for your question. I think, Deb, that I don't have Desiree on camera, but I think Deb mentioned that Desiree's hand was up, and I do have a couple of questions in chat too. Desiree, did you have a question?
Sure, but I can wait for, sorry, I was just eating my lunch. So I didn't think everyone would see me doing that. It is the lunch hour after all.
Yes.
I'm happy to wait whenever you let me know.
Go ahead.
Okay, great. Well, wonderful to see you, Rachel. And thank you so much for sharing your story. I know we're just scratching the surface of it, and it's great to have you as a fellow Mo-Wester. I guess my question is just to dig a little bit deeper. Sorry, half my face is there. Just to dig a little bit deeper in terms of the connections you've made between, you know, health and even educational, but particularly health outcomes in our Indigenous communities and developing countries. And in fact, as you know, those health and education outcomes are often lower in our Indigenous communities than they are in developing countries. And that's a real reflection, I think, on, we have a lot of work to do in Canada, but not a lot of people make those connections. And so I just am interested in you sharing more your story about the international work, how you came to a lot of the human rights work internationally and have made the leap, although you continue to work internationally, in terms of what's happening here in this country. So I just want to hear more about that.
Yeah, thanks for that, Des, and it's great to have you back in my West, by the way. I never expected to find a crisis of the magnitude that we have here in Canada. I never expected to find that here. I mean, when I've been traveling in Inuit communities, the conditions of living and the conditions of life are worse than what I've seen in refugee camps in other parts of the world. The fact that people are living in Canada and they don't have access to clean water, they don't have access to proper healthcare, they are treated as second-class citizens, there is blatant racism, there's blatant disregard for the way that they live. We've known for how long have we known that Inuit people are living in substandard housing and living maybe 17 to 20 people per house in 2 to 3 rooms with only very poor heating, walls made out of plywood. It's horrifying, and we don't hear enough about it. You know, when I was in Nunavut, it's like entering into another country. It feels like another country because the news is different, the newspaper news is different. And when I would come back down with my colleagues, you'd hear nothing about what was going on there. Yet when I was up there, I was hearing constantly about suicides, murders, people living in these terrible conditions. And I read much more anodyne news here in Montreal about things that would never even up there would kind of go like, really, is that the biggest problem that you've got right now? So it's extraordinary, this gap that there is. So how does that relate internationally? I never thought that the skills that I'd gathered being a member of Médecins Sans Frontières and working all through Africa, Central America, Southern America, in Asia, I never ever thought I would be able to use my skills here in Canada. And what I realized when I went to Nunavut was that I could use the most basic skills that I'd learned when I was 25, when I'd started with MSF. And that was extraordinary to me. And that the level of connection with those communities was non-existent in Canada, whereas I've seen in other countries. I can give an example, for instance, in the Democratic Republic of Congo, where they have communities who are living in very difficult circumstances, but there's this sense of solidarity that goes quite broadly amongst the villages and the different communities, and the kind of help that's going on between them. And I didn't see that kind of mutual solidarity here in Canada. So I guess that would be it. One of the things that I saw very quickly when I was in Nunavut, and I would make, and one of my colleagues actually worked for many, many years on HIV in Southern Africa. When I would make allusions to the work that I'd done, the immediate response I would get is, but we're not Africa. And then the assumption that in Africa, well, everyone is, you know, very poor and very badly cared for, and you cannot make any parallels between what's happening in Canada and what's happening in Africa. And actually, that's not the case. You know, we have this false idea that there is a North and a South, a developed and a developing. This is like so like 18th century thinking. That is not the case today. In every country in the world, you have your extremely rich and you have your extremely poor, you have your extremely privileged and you have your extremely marginalized and vulnerable. And it's the same in Canada as it is in the US. Look what happened in the US when COVID broke out. Who got hit? The Navajo Nation. They were some of the first people in April of this year to get really, really severe COVID and to get very dramatic results inside their community. So the link, Desiree, is for me is very, very clear, much clearer than any of us would like to admit. And certainly the Canadian government or Canadian authorities would not like to admit it. When I look at the situation of some of the migrants here in Montreal, they're living in also very, very difficult circumstances, and we're not helping them as much as we should be. So I'd leave it there.
That is amazing. Desiree's got her thumbs up. Amazing perspective. And so, and in some ways not, I mean, terribly shocking to hear you say the conditions that you found here, but also not shocking because it's true that we have known for decades what's been going on and nothing's been done about it. So thank you for that. There's a question from Kate Shingler in the chat. Thanks for sharing your experience and perspective with us. Rachel, where do you turn to for information and inspiration? I'd be interested to hear, have you read anything recently that you'd recommend? Do you have any news sources you consume regularly that speak to your very global perspective?
Oh, it's a wonderful question. I'm so glad you asked, Kate, because I just finished reading something last week that I think is a must read for everybody. It's a book called The Moral Imperative by Jacqueline Novogratz. I don't know if I've only recently been introduced to Jacqueline Novogratz. She's done some TED Talks, and so you can have a look at those. You can just look up her name. But she wrote this book called The Moral Revolution, and she's basically talking about something rather similar to what I'm talking about, but on a kind of a broader scale. She's basically saying that our society today has lost its moral compass, and we need to go back to basics, essentially, to humanity, to love, to solidarity, and use those as our guiding principles rather than using guiding principles of money, profit, and self-interest. And so she's talking basically about creating a caring society, a caring economy, where we can combine and start to value those what we consider intangibles, because we can't put a financial value on them. And for me, it was so extraordinary to read that as a short book. It was so extraordinary to read it because it voiced and enunciated so eloquently the thoughts and feelings that I've been having about how we need to move forward after COVID-19. So that would be my top pick. News sources that I consume regularly: New York Times, Globe and Mail, and The Guardian, and my three go-to papers. I also read the Nunavut News and I also try to read some of the local media, because this is the ones that really tell us what is actually happening at community level. And for inspiration, I turn to the communities. Today we had a call with 15 community members from Central America and here in Canada to talk about the challenges that they were facing from COVID-19, and to see those big smiles coming on, whether in Guatemala, Honduras, Peru, Colombia, and coming on talking about what it's like to be a woman today in their community with COVID-19, or how they're responding to the emergency in their country, how they're helping their neighbors and the children. I mean, this gives me inspiration. I mean, how can I not do what I do when these people are just doing the most extraordinary things at community level? But they're the unsung heroes always of these crises. So,
lovely, great questions. I don't see any more in chat. Deb, do you see anybody else that I might not be seeing?
Oh yes, there's one there.
Oh, sorry.
Jim and Maureen. Jim has a question, I think.
Go ahead, Jim.
Hi, Rachel. Hello.
Hi, Jim.
I'd like to know, to have you say a few more words about women in philanthropy and women in your work.
That's a great question. So I think this series is such a wonderful idea to highlight the role of women and the importance of philanthropy to be able to uplift and empower women to do what they need to do. I think that the issues around gender inequality have dogged us for decades as women. And I think that we're turning a curve now. Really turning a curve. People have said, oh yes, but women are so equal. I mean, you get the same opportunities as men now, you know, what's the big deal? The reality is that that's not the case. And even I don't consider even in my life, I've had so many incidents where I've found that I've been sidelined because I'm a woman, and not even to my face, but sort of behind my back. And it's really a time to make sure that that doesn't happen to the new generations. I see someone who's Katie is here on the call, who seems to me more of a younger generation. So thank you very much for coming. But we have to make sure that the Katies of this world and all the Katies that are going to follow her are really able to march in places that even myself, Desiree, maybe Kate, we were not able to do as freely. As I hope the next generation is going to be able to do. I think that the women have a great role to play in terms of thinking about how to move away from this form of capitalism, which only values one aspect of who we are and one aspect of our society. I think women have a natural inclination towards valuing what is human, what is solidarity, what is caring. I'm not saying that men don't do those things, they do. But the systems that we've created so far have not allowed this aspect to really come up. So I'm really hoping that by having more women involved in philanthropic causes, if you like, is going to help that, but also women who are working in many different things, whether it's in a business, social entrepreneurship, in the health field, in any field, are able to really stand up and make their voice and their values heard. And that will require some shifts in the system and some more active and proactive steps to be made to allow their voices to come through.
So we have a couple of other questions, some thank yous. Ange, who tuned in a book. Oh, hang on. She says, "Dear Rachel, thank you for all you're doing. So much good for the communities, for the world. I've been many of the places you've been to. I've felt and seen what you described. I'm impressed and thankful for all that you're doing to make a difference. And in so many different areas, you're an inspiration, and you can hopefully motivate us all to do a bit better." I think that's true. Katie is thanking you for this talk, your perspective inspiring. Patrina wants to know, do you see any positive, long-lasting changes coming about from the pandemic?
Oh, absolutely, Petrina. I mean, I'm extremely optimistic. I need to be very careful how I say it, because I know that people are still suffering hugely today, and the suffering's not over. And in whatever I say, I want to acknowledge that and acknowledge the losses that people have, the fear that people have. It's a factor of our daily lives. We're all living with that, and we've all experienced and lived that in different ways. So I want to acknowledge that. But in my kind of darkest moments, I remember also that this is giving us an opportunity to really bring about some fundamental change, systemic change, which is what we need. It's not anymore about tweaking the edges of a system. It's actually about bringing some fundamental changes in the way that we do things, so that we do not have to continue living in a world where the poor are getting poorer, where black people are sidelined and marginalized, where Indigenous people are sidelined and marginalized, where women don't have an equal voice to men, where we're not all able to live in a happy and healthy society. We can make those changes. We can do that through politics, through elections, but we can also do that on a community level. And where I am now today, with my experience, I believe the change comes from the community. I'm so tired of big global things. I'm tired of big global politics. I'm tired of national politics and being disappointed again and again. I believe that if we really want to change things, we need to do it at our community level, make those changes at our level, and in time, that ripple effect that we get from those community changes is what's going to force the system to change. We are the change makers, we are the system changers, and we all have a voice in it. And by doing what we do in our own communities, we are making change. It doesn't have to be bigger than that. If we can do something in Montreal West that makes a difference, we're making change. We're part of the move to make a change. We don't have to be all flying around and in big platforms. We do it here today. Just in this meeting, I'm going to walk out feeling happier and more connected to my community, and that brings me joy. And yeah, so that for me, I think, is something lasting from the pandemic.
I think that's a great note to wrap up on, Deb. I think we should give the website again, www.seechangeinitiative.org, SeeChange, S-E-E, changeinitiative.org, if anybody wants to take part in that fundraiser. Deb, anything else?
I will post, there was a book, Angela posted a book she read that was inspirational. So I will be posting certain notes up. I have recorded, but I'm new to this environment, let's be real. And I only started recording about, I missed the first 5 or 10 minutes, but I did get most of it. And so I will be posting that too. Give me a few days though. But I just have to say, Rachel, you've been very inspirational. I'm working in a small public library. I'm all about community. I'm all about education. I'm all about bringing people like you that I like to talk to people, and I met you running, I met Joy running, I met Kate running, and I met Jamie through our children, and I like bringing the people that I find extremely fascinating and interesting, and bringing them to the community, because it's the people in your neighborhood, and these are the people that we live beside and we may not know, and I agree with you. This has been very inspirational. My objective for the next couple of meetings, we'll get some more men in here. I would really like to thank the men for attending this, because when it says women in philanthropy, sometimes a lot of men feel, oh, it's another woman thing. And especially men of a certain generation, I'll say, not so much the younger ones, but I'm really thankful for, Jim and Ron and I think that's it, for coming in, and let's try and get some more men in here, because I do think your words were inspirational. They weren't for women, and I really, really appreciate you coming in. So thank
It's been
you.
such a pleasure.
And,
Thanks for organising it. And
if
if anyone
everybody-
wants to contact me, you can. It's just rachel@seechangeinitiative.org. Please don't be shy. I'd love to hear from you. I'll put it in the chat for anyone who hasn't.
Bye, everyone. And thank you, Jamie, too.
Bye.